Good evening, everyone. Welcome to our LAMP CAA assessment. We are now on week 2 of module 4. And for this week, we shall tackle or we shall review everything that we have learned in Shaoyin and Taiyang channels. No? So dito po naka-revolve lang lahat ating questions. Okay, so let's start. Let's call on Ma'am Angel ko. Good evening, Ma'am Angel. Would you like to take care of 1 to 10?
Good evening po, Doc.
Good evening.
Sige po.
So yung first type, this is the simple multiple choice type. We have 4 or 5 options. Only one is correct. Let's start with number 1.
Number 1, all the following organs are linked with the kidney channel except answer ko po is spleen po, Doc.
Okay,
Letters.
all of the channels are linked with, all of the organs are linked with the kidney channel. So this is with regards to the linkages, or all the organs that are linked to the kidney channel. So the spleen, the kidney channel is not linked with the spleen. So liver, I think it's very, it's a common, it's a given that the liver and the kidney, they always work together, especially sa mga medyo maedad na, no? And you've seen the connection between heart and kidney, yung heart and kidney disharmony, and lung and kidney, mother and son, okay? And obviously the kidney. So hindi po kasama ang spleen. Let's go to number 2.
Number 2 po, which of the following channels has a branch which arises from the lung, joins the heart, and runs into the chest? Answer ko po is letter A po, Doc, Taiyang po.
Ano po yung... Okay. Shaoyin is what channel?
The lung channel po, Doc.
Actually, hindi po nag-a-arise sa lung ang lung channel. Diba, naaral na natin yan? So this is actually a trick question. Just because it's called a lung channel or Taiyang, hindi po siya nanggagaling. Wala po siyang branch that arises from the lung. Would you like to give it another try? What's your other option?
Other option po, Doc. Teka po spleen, Doc. Or hindi rin?
No, foot lesser yin.
Okay.
The answer is letter B. Any
Okay.
comments? Ano po yung foot lesser yin?
Kidney po.
Okay. Kidney. Okay. Any comments? Yan po yung ating answer. Kidney channel. The kidney channel, meron po siyang branch na nag-arise from the lung. Di ba kanina pa natin to inano? So the kidney is always related to the heart. Okay? In fact, if you have heart issues, you will always have to look at the kidney. Yeah, di ba? Yung kidney heart disharmony, that's very, very common. And so the kidney channel, meron po siyang branch na nanggagaling po sa lungs kasi they are mother and son. Okay? Kaya if we have to take care of our kidneys. Okay? Tapos tumatakbo po siya sa chest. Okay. Number 3.
Number 3, Doc. On the abdomen, the Chong channel communicates with, answer ko po yung REM channel po, Doc. Letter A po.
What is another name for the Chong channel? Actually, they're separate. They do not communicate. Okay, the Chong is penetrating channel. Don't worry, we're going to take this up in detail in the weeks to come. No? Would you like to give it another try?
Ano
Actually,
po?
every time you think of the Chong channel, this is the reason why some women will always have issues with their reproductives. So nagko-communicate siya. I'll give you a clue. It's, of course, hindi nakasama si Ren. Hindi po sila nag-communicate. Although the Ren and the Chong, they are very important extraordinary channels for women, especially. So which of the three, stomach, kidney, and spleen?
Ano, Doc?
Yung
Try ko po,
pinakamalapit.
parang kidney, Doc.
Okay, very good. Kidney channel. Okay. This is very important, especially when we go to pattern differentiation. Number 4.
Number 4 po. On the abdomen, the yin-wei channel communicates with kidney channel, Doc. Letter C. Si
Ano po
yin-wei.
yung source mo dito? Is that a guess?
Sa ano lang, Doc, sa internet lang po. Yin-wei, may
Okay, would
parang
you like to give it another try? Ano another name for the yin-wei channel? Sige lang, I just wanted you to be prepared for the future topics. Okay, the correct answer should be spleen channel.
Okay.
Okay. Letter A. Number 5.
Number 5 po. Which of the following point is level with stomach 20?
Mhm.
Answer ko po, Doc, yung REN 15 po. Letter B.
Ano po location ng stomach 20? Can you give us the anatomical location of stomach 20?
Stomach 20 po, Doc. Ang location niya po ay ano, Doc? 5 kun above the umbilicus, 2 kun lateral to REN 13.
5 soon above the umbilicus?
Yes po, Doc. Si stomach 20 po.
And what about REN 15?
Actually, ang answer po dapat talaga REN 13 po, Doc, no?
REN 13 nga.
Opo. Hindi 15, kaya lang wala siya sa pilian. Kasi nakalagay po yun siya yung parang tukon lateral. So, ibig sabihin siya yung ka-level po.
Ka-level. Okay, can you tell me, sino-sino yung kasama ni stomach 20?
Stomach 20 po, ang kasama po niya is kalang, Doc.
Kasi kung
Ang kasama po niya
mo,
si...
okay, you mentioned about the location ng stomach 20, which
Opo.
is 5 soon above the umbilicus, di ba?
Yes po, Doc.
Okay, can you tell us the location of kidney 20?
Kidney 20 po.
Okay, ganito. Bakit mo sinabing REN 15? So, REN 15 kasi, ganito po kasi, may technique yan, no? Like, we use the umbilicus as REN 8, right? So, if you go up, ang ginagawa natin, sinasubtract natin yan. So, obviously, pag sinabi mong REN 15, 8 soon na yan. So, definitely, hindi na sila magka-level. Diba? Kasi sinabi mo, ang stomach 20 is 5 soon above the umbilicus.
Okay.
So ito ang technique niyan. Just like REN 12, di ba? REN 12, if you subtract 8, kasi the umbilicus is REN 8, di ba? So pag sinabi mong, di ba, pag REN 12, 12 minus 8, that's 4 soon. So pag sinabi mong REN15, that's 7 tune. So hindi na po sila magkaano. Hindi din si like 14. 14 is 6 tune. So mali
Tama.
si A or B. So we are left
Kidney nga po, Doc, kasi 5
sino
tune
dyan sa
above the
tatlo?
umbilicus din siya. Kidney 20, Doc. Siya
Okay.
rin kasi yung 5 tune above the umbilicus
Yeah,
ng
can
Doc.
you be very, very precise about the location? Ilang po siya from the midline?
5 tune above the umbilicus, 0.5
Okay.
tune
0.5.
lateral to the anterior midline po.
Okay, very good. So you need to be very careful with this. Kasi like, especially if you want to really affect the penetrating channel. Alam naman natin ang penetrating or chong channel, wala yung mga points, but we use the acupuncture point. So ito po ibig sabihin noon, connected po si kidney channel sa chong vessel. Number 6. Now, this
Number
is
6 po.
Okay, very easy po.
The point located in the center of the suprascapular fossa is ito pong Doc, letter B po, si small intestine 11 po.
Are you sure? How do you locate
Center, sa center po, Doc.
SI11, gagawa ka ng parang cross, di ba? Dun sa scapula. Okay, I think we need to really, would you be excited? I'd like to do a practicum. Wait lang ha. Ay, unahin muna natin yung diagnostics on November 13. Kasi I'll be attending the TAC Congress 14-15. So, ito siguro for next year. And I'd like you to be very precise about location. And alam nyo, ang dami-daming, okay, SI11, okay, can you tell me the location of SI11?
SI11 po, Doc. Location po is upper and midline, 1/3 of the line between the lower border.
So, hindi po siya sa taas ng scapula, right?
SI12.
So
The answer
SI12.
is wrong, SI12. Alam mo, Ma'am Angel, okay, I understand. Hindi pa natin masyadong itong pinracticum, but as early as now, I want you to be able to palpate it, especially for patients na, like, we just came from this very big event in the Senate. I noticed that most of the people there, they have 98% or even 99% may shoulder pain. And alam mo naman shoulder pain. Why? Because especially yung mga computer na ang baba ng screen, no? So kailangan kasi naka-eye level, and most of them so yung ganun mo pa lang, grabe ng impact niyan sa shoulder, sa ano mo dito, oh. No? Nandiyan yung sternocleidomastoid, nandiyan yung ito dito. Okay? SI12. You have to needle that locally. That's a very good local point. Okay? Even if okay, una kasi you need to know, is it the small intestine that is involved? Is it the large intestine? Yung mga ganon. And I tell you, it's so the patient will love you for it. Okay? So the thing here is, before you needle it, you have to palpate it. So it's usually, if it's tender, then you have to needle it. SI12. So nasa taas po siya ng, nasa center po siya ng suprascapular fossa. Ibig sabihin sa taas po ng scapula. Okay? So I'd like you to look at the anatomy of the scapula and locate where the suprascapular fossa is. Actually, madali lang po siya. It's usually masakit. Promise. Okay? Number 7.
Number 7, Doc. The point located level with Do14 is letter A po, Doc, yung answer ko po. SI14 po.
Are you sure? Can you tell me the location of SI14?
SI14 po, Doc. Alam.
Una-una, nasaan ba located ang Do14? You need to know this.
Do14 po. Sa on the midline of the base of the neck in the depression below the spinous process of the seventh cervical vertebra. Bali
Between
C7.
T7 and T1.
Opo.
Okay. So nasaan po ang SI? What was your answer? SI14.
14 po, Doc.
Can you tell us the location of SI14?
Lateral to the lower border po
Oh,
of spinous process of the first thoracic. So mali
so
po, Doc.
it's not the
Yes.
answer.
Yes, Doc.
I-15.
Yeah, SI15. Can you Google SI15?
Ano, Doc? Lateral to the lower border of spinous process of seventh thoracic vertebra.
Okay, that's it. Seven cervical.
Ay pala. Seventh cervical ba, Doc? Hindi po. Ano.
Cervical din.
C7 and T1.
C7.
Okay?
Apo.
Di bale, i-master
Nakakalimutan.
natin yung anatomy niyan. Ako kasi,
Hmm.
katulad ng style ni Dr. Unahin muna niya yan, then aaralin yung basic. So, let's do that. So, for now, it's good for you to
Medyo na ano ko na, Doc.
familiarize with the
Ah.
this is very important po kasi yung mga landmarks, no, yung mga sino yung kapantay niya. You remind me later. I would like to give you yung ba mga points on the same line. Would you like to have that? I
Yes,
think
Doc.
I gave that before. I think I gave
Para,
that before.
Maganda yan, Doc.
Maganda yun. You remind me later. You may kulit sa group chat, okay? Number 8. And by the way, for those who will attend on November 13, I hope you could find time. I will not do spoon feeding. I'll give you the notes. And what we will do, each one of the participants will have to be analyzed, okay? Using the diagnostic, your diagnostic skills.
Hindi pwede may tubig ako.
Okay. Number 8.
Number 8, Doc. The point most commonly used in treatment of various blood syndrome is, ito, Doctor, na talaga. Bladder 17 po.
Okay, very good. Diyos ko, hindi na kita patatawarin pag nagkamali ka pa dyan.
Sorry, Doc.
And by the way, how are you going to locate it?
Si bladder 17,
Ano yung position ng pasyente? Nakahiga ba yung pasyente? Or mas maganda pag nakaupo? Tapos, anong posture niya? Kasi you need to locate something.
yes po.
And by the way, can you tell us the location of bladder 17?
Location po niya, Doc, is 1.5 tune lateral to the lower border of spinous process of the seventh thoracic vertebra po, Doc. 1.5 tune po.
Yeah, aside from that, there's an easy way to locate it. Ano po yung landmark na yon? Can you look at the scapula? The
Yes
lower
po.
spine? Okay. You ask the patient to do like that. Tapos i-ano mo yung arm niya sa likod.
Ay, ganun, Doc.
May makikita mo talaga yung I think you know what I'm talking about, bladder 17. That's
Yes.
a better way. Yeah, and then you have to just make sure na 1.5 soon siya from the midline, no? T7. Below the spinous process of T7. Next, number 9.
Number 9 po. The points heart 8 and pericardium 8 are commonly used together to clear the fire of the heart po, Doc.
Why? Ano po yung kanyang how would you call it? How would you classify heart? I'm sure you're familiar with the 5 shoe points.
Ano po siya, Doc? Si heart 8 po ay ano po siya? Ying spring po, Doc. Tapos
Ano pa?
early
Fire
point, Doc.
point siya. Fire point.
Fire
Okay.
point. Pareho silang fire point.
Kung
Doc.
si pericardium 8 and heart 8 are fire point, sino ang wood point?
Wood point niya, Doc, is heart 9 and PC9 po.
Good. You got it. Number
Thank you,
10.
Doc. Number 10 po, what action would it produce when the REN23 and kidney 6 are simulated simultaneously?
Okay.
Letter D, Doc, yung regulating the function of stomach to stop vomiting.
Did you use a book on that? Connection ni... Okay, can you tell me the main function of kidney 6?
Si kidney 6 kasi, Doc. Teka lang. Main
Mukhang
function.
ayaw mag-agree ni Dr. Sam.
Ah,
Okay, yung REN23, just by the location itself, would you be able to, like, I think it's a given when you know where the REN23 is.
REN 23 po.
Okay, let's answer po muna kidney 6. Baka medyo na-rattle ka na.
Ah,
Ano yung nagagawa ni kidney 6?
si kidney 6 po kasi pang ano siya, Doc, pang irregular menstruation.
Ano, can you tell me the mechanism, the function? That is an indication. That is not
Okay.
a function.
Kidney 6. And
Ano ba source mo?
sa internet lang, Doc.
Oo nga, ako din eh. But di ba I gave you a book ni Machocha?
Okay. Hindi ko po nasilip po yun, Doc.
Silipin mo na ngayon.
Teka lang po, Doc.
Okay. And siguro, by this time, alam mo na po yung ano. Okay, ang function niya po, actually, it is one of the best points to nourish kidney yin. So, yung mga merong kidney yin deficiency. Ano ba ibig sabihin ng kidney yin deficiency? Like, ano yung possible problem when you have kidney yin deficiency? Una-una, ano itsura ng tongue if you have kidney yin deficiency?
Ano po, Doc? No coating?
No coating?
Yes
Yeah.
po.
And what
And
do you think? Like, I'm sure you're familiar with the yin deficiency classic symptoms, right?
yes po, Doc.
And what are they?
Kapag kidney po kasi, Doc, may red na po siya, no? Kasi affected tingin ko din si heart.
Yeah, but yeah,
Dahil hindi na niya
kasi
na-nourish.
nakita mo kidney yin deficiency, may empty heat na. Pero ang ano ko kasi, like, kung titingnan mo yung mga choices, may anxiety, relaxing the muscles and tendons, relieving the phlegm. Do you think it can relieve the phlegm?
Si kidney yin po.
No, kidney 6. Kasi sinabi natin, one of the
Okay.
best points to nourish the kidney yin. So we're talking about, would you be needing something to tonify the yin if you have phlegm?
Yes po, Doc.
Madami yung phlegm niya.
Apo. Ay,
Phlegm
pag
is very
tinotify,
yin. Okay, what about yung answer mo is to stop vomiting. Do we see any connection between okay, when you say use vomiting, this is actually a weak or a rebellious stomach chi, right? Or a very weak stomach. Pero mukhang hindi siya connected with kidney 6. So ano kaya ang answer natin dito?
letter, ano, Doc? Letter C? Ay,
Kasi how can it relieve phlegm na
si ano po, Doc?
supposed to nourish the yin? So dadami yung phlegm.
Si ano po, Doc? Tingin ko pala.
Okay, can you tell me nasaan ang REN23?
Si
Do you know
Ren,
what it is?
Ren 23,
Location pala ng REN23, alam mo na anong Alam mo na ano issue eh.
Ren 23. Sa ano,
Nasaan?
yung
Di ba
Ren 20?
sa lalamunan?
Dito, Doc.
Okay. Sa mga choices dito from A to E, which do you think is, the most likely answer?
Ay, yung ano, Doc, letter E po,
Okay.
promoting secretion.
Yeah. Secretion of body fluid to relieve thirst. Throat. So pag sinabi mong thirst, there is actually yin deficiency already. Meron na siyang El Nino, right? Okay. Did everybody get that? Okay, alam ko medyo nakaka-stress yung mga mga tanong, pero we have reached the point where you have to already exert a lot of effort. Okay, nasa module 4 na po tayo. Okay, thank you very much, Ma'am.
Thank you,
Angel.
Doc.
Let's go to number 11 to 20. Can I ask Ma'am Ami?
Good evening, Doc.
Good evening po.
Number 11, the point level with rent 10 is
Mhm.
my answer, Doc, is letter B, stomach 23.
Very good. So we don't have to look at the ano kasi the answer is correct. Okay, very good. Number 12.
Which of the following points is located 2 tune above the lateral superior border of the patella?
Hmm?
The answer, Doc, is stomach 34, letter
Okay.
C.
What is the classification of stomach 34?
Stomach 34 is the C-cleft point of the
Okay.
stomach.
Very good. In fact, my patient this afternoon, yan ang ginamit ko kasi she had GERD. You know GERD? Reflux, acid reflux. Pag pinalpate mo yan, masakit. And she was very happy. Okay? Stomach 34. C-cleft point.
C-cleft point.
So you have to learn how to palpate it. 2 tune above the lateral superior border of the patella. Okay. Stomach 34. Sino pong kapitbahay ni stomach 34?
Stomach
Of course, it
34
would
po
be the
is
spleen.
stomach, ang kapitbahay ba o yung below?
No.
Ah,
When you say kapitbahay, magkatabi yung bahay niyo.
opo.
So,
Yung
stomach 34, I'm talking about the spleen.
spleen po. Spleen kayo.
Okay, ganito na lang. Bigyan kita ng ano. Sinong, you know where spleen 9 is, right? You know where spleen 9 is? Do you know spleen 9?
Spleen 9, Doc.
Yeah, it is called the Lasix point,
Nasa-
hypretic point. Ginagamit natin yan pag mayroong dampness, di ba?
Opo, spleen 9 po.
Okay, sino po ang kapitbahay ni spleen 9? Di ba Hussey point din? Hussey point si spleen 9?
Easy point of name. C point.
So, yung kapitbahay niya, sino? Yung yung pinaka-common natin na nilolocate.
Spleen 6 po.
No, kapitbahay. Ang layo ni spleen 6. So pag sinabi natin kapitbahay, yung katabi niya. So I'm talking about stomach. So ang hanapin mo din yung Hussey point din ng stomach.
Okay, Doc. Easy point ng stomach.
In fact, it's called the lower Hussey point.
Okay, stomach. Easy point, stomach 36.
Ano yung Oh yeah, very good. Okay. So ngayon, ang pinag-uusapan natin si stomach 34. Ang tanong ko, sino yung kanyang kapitbahay?
Spleen 10.
Yeah, very good. Okay. Ang galing. Okay, yes. Okay, yung sumagot si Sir Michael, saan po ginagamit si spleen 10?
Nakita ko lang kasi nakakonect.
Okay.
Naka-align kasi
No,
accidentally
you have
lang.
to know.
Kaya po,
Katulad ni Stomach 34, ginagamit natin siya for, di ba,
girl.
Sheila, point siya. Kung meron kang
Oh.
acid reflux or GERD, no? Masakit yan. Magpapasalamat sa iyong pasyente pag ninidal mo yan. Okay. Sabi ni Sir Michael, si Spleen 10, yung kanyang kapitbahay. Ang tanong, kailan mo ginagamit si Spleen 10? Okay. Actually, it's very good for blood stasis. No? We usually combine it with bladder 17.
Bladder 17.
Yeah. Did you get it, Sir Michael?
Opo.
Okay, balik tayo kay
Twins yan.
Ma'am Ami.
Ay,
Okay,
so yung
10 and bladder 17 are good for blood stasis, right?
Apo.
Can you tell me how the tongue looks like when you have blood stasis?
Purple tongue po.
Okay. How will the pulse feel?
The pulse is choppy.
Very good. Okay, I'm proud of you. Thank you.
Okay, thank you.
Number 13.
Number 13. The channel which abound in blood and have relatively less Qi is, my answer, Doc, is letter B, or Taiyang and Julian channels.
Okay, very good. Taiyang and Shaoyin channels. Okay na? Get na?
Get this.
Madaming dugo, kaya may pain parate. Yan. No? Taiyang and Shaoyin. Remember Shaoyin? Liver and pericardium? Chest pain? Ano pa ba? Liver chi stagnation. Okay, number 14.
Number 14. The point between the tendons of M. semimembranosus and semimembranosus when the knee is flexed is letter A, kidney 10.
Okay, very good. Kidney 10. Number 15.
Number 15. A point frequently selected in treating blood diseases is UB17, letter C.
And then you combine it with what? Plus?
Combined with
Spleen 10.
Spleen 10.
Oh, kanina lang? Okay, number 16.
10. Number 16, the prescription containing the point Q14, lung 11 has an action of try ko lang, Doc, letter B, activating the dispersing functions of lung to relieve the exterior symptoms.
Actually, tama ang sagot mo. Hindi ka nag-try. So, thank you for your effort. Actually, somebody asked me about this. Nakakatawa. Tinanong ko man ako, nandito siya. I'm sure wala siya dito. Wala nga. No wonder. Anyway. I think it was ang aga-aga ha, 7 o'clock. But anyway, okay lang. Tanong niya sa akin, ano po ang difference ng aversion to cold and yang deficiency? Sabi ko, siguro mas maganda ang tanong mo, saan, ano po ang pagkakaiba ng aversion to cold sa sa wind cold invasion and yang deficiency? No? So we know that if it is wind cold invasion, no matter what you do, kahit balutin mo ilagay mo sa loob ng malamig pa rin kasi the wind cold was able to prevent the wei qi to go to the surface. So hindi mainit ang pakiramdam kahit anong gawin mo kasi nakabara na siya, di mo nakabalandra. Then the next question that she asked, so pag may yang deficiency ka, pwede pang mawala yung version, yung feeling cold, di ba? Yun lang naman yun. Balutin mo, mawawala. So dito makikita mo yung distinction. So pag kahit anong gawin mo, malamig pa rin, nag-chill pa rin, that's wind cold invasion. So I know what she wanted. So sabi niya, Ano pong gagawin? Kasi may pasyente daw siya. You know what I said? Eliminate the wind. And she did not, kasi she was like fishing for points. And by the way, I don't spoon feed. Okay. Lahat po tayo merong ability to Google. I have given, I think, I don't know I think we have the most number of references. Hindi nyo nga mabasa, no? Anyway, so yeah, this is correct. Don't forget to needle bladder 12. And of course, we need lung 11 because di ba ginagamit natin yan siya? It's how do you call this? Yeah, wood point. Talagang tinatanggal niya po yung wind. And do 14. So pag nanlalamig yung pasyente, you tonify do 14 or you moxa it. Pero pag mainit, you sedate it. So depende po sa needling mo, right? I think you know it by kasi pag lumala yung fever, so there's, you did not train with us. Kaya you should always have this shawl, lalo na pag medyo may edad na tayo, no? Buti na lang nung pumunta kami sa Tagaytay. Thank you, Dr. Sam, for that very memorable, date, lunch date.
Yes,
I'll
Doc.
never forget that. Dr. Ryan was so impressed, and we love the coffee. Oh my God! So in fact, it's my
Okay,
favorite.
Mateo.
Yeah, we bought some coffee. Ay, wag na, iba na tuloy. So ito po, do 14. So you tonify do 14 pag nanlalamig yung pasyente, or you moxa that, no? And bladder 12, that's one zone away from bladder 13, di ba? So usually, if you palpate that area, it's so masakit. And of course, we have lung 11. Lung 11 because we want to treat the sore throat. Di ba may sore throat usually pag pumasok si wind. So if, very good, Ma'am Ami, activating the dispersing function of the lung to relieve the exterior symptoms. Thank you. Let's go to number 17.
Number 17, the pathway of the Chong channel of the abdomen coincides with what of
Kanina pa yan.
kanina po, letter C, Doc, kidney
Okay,
channel.
very good. Kidney channel. Number 18.
Number 18, each of the following organ has connection to the course of the kidney channel except letter C, Doc, spleen.
Okay, giveaway. O tingnan mo, pag sinagot mo marami. Okay. We have another 1920 pa kayo, ma'am, ha? Okay. Each
Yes,
question contains a group of options followed by a series of questions. So for each question in the series, select the answer you consider to be correct. You can choose the answer several times or not at all. Okay, 19 and 20, ma'am. Ami.
Number 19.
So we have a case here.
A patient has the okay po. Number 19, a patient has the following signs and symptoms: insomnia, restlessness, flash face, dry mouth, difficult urination, scanty in amount and red in color, burning pain in the urethra. In making a prescription, according to the matching method of beyond source and connecting points, ang choices po, Doc, the U1 source would be
this is what you call the guest host method. No? The guest is the yuan source. Forgive the spelling, hindi po L-O-U, it should be L-U-O. And the host is the yung ka-related niya na channel. Okay? Okay.
ang answer ko po, Docs, is letter C or kidney 3. Tama po ba?
For
Human
number
source.
19.
For number 19 po. Ang choice po for kidney 3, meron po siyang difficult urination. Tama po ba? Scanty in amount. Kidney 3 po.
What is your number 20, the luo point? So ang luo point mo, dapat bladder.
Ang
Wala
ang
tayong
luo-
bladder dyan.
Opo. Wala po.
So mali na yung number 19 mo. Diba? Do you get it? So this is actually the guest host method, yuan source and luo connecting. So example, pag kidney yung tamang sagot, kunin mo yung yuan source point, kidney 3. Pero yung kanyang host, yung kanyang guest, yung host pala is yung luo connecting. Actually, this is the best way to treat issues, no? Like yuan source is always, ang matalinong practitioner would always combine yuan source with the luo connecting. Pero dapat related po sila, no? Katulad ng ang sagot mo is kidney. So ano magiging number 20 mo? Wala tayong choice na bladder dyan.
So,
So mali na. Okay. Can you give me, aside from kidney, that will give you, diba, dito ko ina-emphasize na pag sinabi mong, okay, wag mo talaga, like, there is always a connection between, yung mga channels, may mga connections sila eh. Okay? So katulad nito, sa ano natin is alam natin na kidney to. Diba? Pero you should always bear in mind na pag pinag-usapan si kidney, hindi lang si kidney yan. Meron pa. So sino kaya yun?
Ano connecting point just po ba, Doc? Na tayo?
Okay, when you also have issues. Okay.
Heart pipe po, Doc, letter D.
Heart 5.
Yes po.
Remember, ang ano mo,
Insomnia.
meron na po siyang burning pain. And una-una may insomnia, restlessness, flushed face, dry mouth. So, which one is stronger? Heart 5 or heart 7?
Heart 7, Shannon. Heart 7, Doc.
Yes.
Mm-hmm.
So for heart 7, because the heart and the kidneys, they have to be harmonized. But in this case, hindi po siya harmonized, no? So ibig sabihin, if all you have here are kidney symptoms, it doesn't necessarily mean na yung sagot mo kidney lang. You should also consider the heart. And so between heart 5 and heart 7, I think because of the insomnia, the restlessness, the flushed face, difficult urination. So your answer is heart 7 for number 19? Okay. So syempre, ang pag-iisipan mo ngayon, yung kanyang luo connecting should be SI. Ang tanong, sino dito sa dalawa? You have SI4 and SI7.
SI4, Doc.
Is SI4 a luo connecting point?
SI4, connecting. Doc.
Sige lang, I understand. So,
hindi pa masyadong
ano ang luo connecting ng SI?
H5, heart 5.
7.
SI7. Very good. So, do we have any questions here? I hope everything is clear.
SI7, Doc.
Okay, now you know.
Okay. Doc.
Bakit? Kasi ganito po yan. Tingnan nyo, meron siyang burning pain in the urethra. So that means there's too much fire already. Okay? In fact, what is really happening here is nag-transform na siya, napunta na siya sa SI. Diba? If you remember, if you have urinary issues, you would always think of the SI already. And that means the heart is like so on fire already. But if you choose heart 5, it is not a yuan source point. Do you follow? Of course, pag hindi ka gumamit ng ganitong method, yung guest host method, that means yuan source and luo connecting, you're not going, I would choose, kasi between heart 5 and heart 7, I would choose heart 5. But that will deviate from the rule. Do you follow?
Opo.
Kasi una-una, ang guess daw should be a Yuan source point. Eh, hindi Yuan source point ang heart 5. Right? You get it? So, I hope you can apply this. By the way, I know it's getting a little bit more complicated now, but what we're actually presenting here are the most common cases that you see. Bakit? Karamihan ng mga tao ganyan. In fact, my patient, yeah, he had this problem, but I didn't use this point. Minsan nakakalimutan mo, no? Do you follow? So the urine is red in color. That's too much fire. So I would be tempted to use heart 5 because heart 5 and heart 6 are good for heart, yin, no? Pero you already have a rule. You have to use the guest host, so Yuan source and Lu connecting. That should be the combination. Thank you very much, Ma'am Ami. Good job.
Thank you po. Okay, thank you, Doc.
Very good.
Okay, thank you po.
Okay, let's go to Ma'am Lynn Galarita. Are you ready from 21 to 30?
Yung later po, Doc. Mga 40 po ako, Doc.
Ano po? Later?
Pwede later po, 40 and up.
Okay. Who would like to volunteer? Let's call on Sir Michael. Saint Michael.
Tayo nito.
1 to 30. Okay. Let's go.
Let's go. 21 to 30, Doc.
21, 22.
21, 22. The channel with distribution to the centri of the ear include letter A, Doc. Channel Hang Taiyang, channel F Taiyang, channel F Shaoyin.
Okay. That's the SI, right?
SI po, SI.
Bladder and the triple verb. Yung tatlo dito, remember?
Opo.
So kung gusto mong sumakit ang ulo ng iyong co-practitioner, then you use these terms.
Okay.
So bawal sa atin ng simple, Let's try to be very complicated. Let's develop a culture. Okay, number 22.
22, the channel with distributions, open ko yung campus, Doc.
Connected with the lung.
Distributions to or connected with the lung include channel of Hang Taiyang,
And what is that?
channel of the foot Shaoyang,
What is the Han Taiyang?
ang dami kasi nakalbenda. Foot Taiyang.
Han Taiyang is the small intestine?
Yes, small intestine, large intestine, and the last one is channel of the Hangyang Min.
That's the large.
Large po. So letter C po yung sagot ko, Doc.
Yeah, that's the large intestine, small intestine, and what's the food Shaoyang? Food Shaoyang?
Stomach. Sorry.
The stomach is Food Yang Ming. Food Shaoyang is
Heart.
Shaoyang. Heart is
bladder. Bladder.
Gallbladder. Okay. So your answer is letter C.
Letter C po.
So meron po siyang connected with the lung. So what is the connection like? How did the lung connect with the large intestine? Alam naman natin, interiorly, exteriorly related siya, di ba? So how did it connect with the food Shaoyang? You said it was gallbladder, right?
Opo. Sa bladder, Taiyang ang connection po niya, Dok. Opo, Dok. Ito sa akin.
Okay. So are we all clear? That's letter C. Let's go to number 23.
Medyo complicated yung questions.
Okay. Ito naman,
Uh,
we have 4 options followed by 1 or 2 questions. For each question, select the answer that you consider to be correct. Each option may be selected more than once or not at all. Okay? 23 to 24.
This one, Doc, in 23 and 24, Google din ang ginamit ko. This one.
What's your
May
answer
answer.
for number 23?
Number 23 is letter A, channel for put young men. For 24 is letter B, channel hang young men.
Okay. This is my, I'll give you a tip, ha? Di ba lower
Opo.
teeth? Pag lower teeth, large intestine. So that's actually Han Yang Ming. You agree? So syempre, yung
Okay.
opposite, yung upper teeth, foot Yang Ming. Yes?
Yes po.
Now, my question is, what would be the best point if you have masakit yung upper, upper molar mo?
Ito po. Dito po, Doc, sa may...
Hindi, no, ang tanong ko anong
Anong-
point?
17
Tapos
ba yun?
ano pa yung ngalang-ngalang mo, namumula, may
Oo,
bleeding.
wala.
So what are you going to use?
Ito bin 17, somewhere 70 ka.
Okay, what do you use for pain? Like say, for lower teeth. Kalimutan mo na, LI4, right?
Right.
Okay. What about
LI4.
upper teeth?
Hindi ko po sure, Doc.
Stomach 44, no? Okay, number 25, 26.
26.
Ay, ito very easy, very common.
The point is well selected for moxibuction to correct the position of fetus is our bladder 67 po. Letter B for this one.
Okay, when is the best time to do moxibustion on bladder 67? What gestational age? Diba, Suki?
Jingle, ano po to? Anong questions?
When do you
What's-
do moxibustion? At what? Diba, like ilang weeks ba ang pregnancy ng babae?
9 months po, Doc eh. Pero,
Weeks.
9 months, oo.
38 weeks. Ang tanong, anong week mo pwedeng i-moxa? Di ba naman pwedeng i-moxa lang anytime?
Pwede po pa dito, Doc, ng within 3 months?
No. No.
No.
Bakit mo
Okay.
within 3 months, hindi pa nag-ano? Di ba, kailan ba usually nag-turn ang baby?
Mga 5 months.
Anyone?
Last
And-
time, Doc.
8 months.
What week?
8.
What week?
36 weeks.
Hindi.
37.
Parang
7.
late na ang 36.
Manganganak na yun eh.
You know,
34
Around
38 weeks, very critical na yan. 32 to 34.
Oh,
32.
30 to 30.
Huwag naman yung mga first 3 months. Diyos ko, mahuhulog yung bata.
32 weeks.
Okay, number 26 po.
The points to which acupuncture cannot be applied during pregnancy. Okay na po to, obvious na po to. LI4.
No. Both bladder 67 and LI4.
Both. Okay.
Yeah. Kasi when you say pregnancy, you're pregnant kahit 3 months, first trimester. So you don't do moxa o bladder 67, baka mahulog yung bata. Diba? Hindi pa siya nakakapit.
So,
Pag
walang kapit.
medyo breach na siya, let's ask sino ba dito sino ba yung mga midwifery?
Nakaranas ng buntis.
So definitely you don't do it on the first trimester. Okay? Sige, gawin nyo yan. Yung malapit na, wag naman yung lumalabas na yung
Tsaka
ano, yung
may
nagle-labor na.
friend
Saka
ako
mo
daw,
palang
8
imo-mox.
months. 8 months na breach yung pregnancy niya.
Yeah.
Nag-moxa. Nag-turn, 2 days before delivery.
Ay, talaga?
Nag-cephalic
Nag-ano siya? Nag-turn?
Yeah. Cephalic na yung baby niya nung pinanganak normal delivery.
Oh, you actually witnessed it?
Akong nagkasama ng dinala sa hospital.
Wow.
Saka na-witness ko siyang nag-moxa on, bladder 67.
That's exciting. Kung alam ko lang talaga ito before, we should have been able to see. Kasi lalo na pag primary, karamihan kasi ng mga pregnant, lalo na first time, lalo na sa mga far-flung, yung mga rural areas, hindi sila nagpapa-prenatal.
Yeah.
So, alam mo naman, pag government hospital, ang hirap mag-prep, no? For CS. So, sometimes you need to really deliver the baby. Imagine, breech. So, kung lahat na sana, no, pag na-ultrasound, breech, so siguro. So, would you agree, Ma'am Lynn, that the best time is 8th month?
Yes po. Tapos si Dr. Webb, ang sabi niya, dapat pag nag-moxa on bladder 67, hindi dapat lalampas 20 sessions. Kasi pag beyond that, wala na daw yung effect.
Okay. Did you mention about ano yung time? Ano yung week?
Wala specifically, pero last trimester.
Siguro usually last trimester. Very good. Definitely not first trimester. Kaya the answer here, Sir Michael, should be both A and B.
Opo.
Kasi you do not moxa bladder 67 kung first trimester. Okay.
Okay po.
Okay, by the way, how would you know if pregnant ang babae? And feeling the pulse.
Feeling the pulse. Mabagal na sa doc.
No, what is the quality of the pulse?
Pulse.
But slippery din. But anyway, mas mabuti pa yung, anyway, meron namang mga ultrasound. Magpa-ultrasound ka na muna. Okay. Next, we go to, we are still with you. Okay, ito naman, okay, this is really, do you want your exam to be like this? This is very challenging. 1, 2, and 3, 1 and 3, 2 and 4 are correct. Letter C, letter D, and E if all are correct. Okay, go. Sir Michael, kaya mo yan.
Number 27, the channel distributing to the back of the body include. My answer for this one, Doc, is 1 and 3, the bladder channel and the duct channel.
Very good.
Letter B.
BC. Number 28.
28, the channel passing through the medial aspect of the legs. 2 and 4, the spleen channel and the gallbladder. Which number? Letter C po.
Are you sure? Gallbladder? Medial aspect?
Ito po isa rin ang sagot ko po, Doc.
Okay,
1, 2, 3.
nasaan yung reference mo niyan? Did you use a reference for that?
Only this one, Doc. This one.
Sigurado ka, meron dyan?
Nasaan yung
gallbladder? Medial o lateral? Can you give me a generalization of the location of the yin channels of the leg? Where are they located? Medial or lateral? Of course, if you talk about the yin channels, let's also talk about the yang channels. So ano?
Letter Sige, ang magiging sagot ko po, Doc, yung other answer ko po. Letter A, the liver, the spleen, and the kidney.
Okay, those are yin channels. Okay, so your first answer is wrong. Okay? So liver, spleen, and kidney are yin channels. Nasa medial aspect sila. Okay? Number 29.
Number 29. The channel linked with the throat include letter E po, Doc, the lung channel, the liver,
all
the
of
kidney, and then the stomach channel po. All of it po.
Yeah. Yes. Just like I'd like to share with you, no? Like my patient kanina, she had this what did I say? Yung dinamitan ko ng stomach 34. Sabi niya may ano daw siya, parang may konting ano sa lalamunan. So kung hindi mo talaga alam yung history, you wouldn't think, you might think na meron siyang wind heat invasion, di ba? Sore throat. Hindi naman, it's just an irritation. So, now we know that the stomach channel is linked with the throat. You follow? So,
Opo.
lung channel, of course. So, hindi lang puro lung. Oo, kasi you might use lung 11, lung 10. So, liver and kidney and stomach. Okay, number 30.
The question po, Doc, that for this one, Doc, is yung, can I combine all the key points like sa stomach? So 29 po, Doc, lahat po ng may lung points, liver, kidney, not related to throat, pwede po bang sabay-sabayin siya? O pwede lang isang
No,
no?
you have to decide based on the presentation ng pasyente. Hindi mo ilagay ko na, okay, the patient came in with sore throat. Tusukin yung yung point sa lung channel, liver, kidney. No.
Okay. Okay po.
You need to be very accurate. You just choose one of the four. Okay?
Okay po. Thank you po, Doc.
Alam mo ba, pag liver channel, no? Especially when you have liver qi stagnation, di ba? Ito yung mga taong nai-stress. Di ba meron ka ling, are you familiar with the, itong may plum seed sensation? I had that when I was preparing for the medical boards in, never mind the year. That was the year na gumuho yung hotel sa Baguio. So alam mo na kung anong taon. Then sabi ko, my God, baka ma-postpone yung board exam. No, di ba? Like, ma-stress ka na naman, mag-aaral ka na another. So hindi na postpone.
Through that point, no? Grabe.
Yeah. So sabi ko, bakit ito? Parang wala naman akong sipon. Pag na-stress ka, because the liver, you know, when you're, of course, kulang tulog kasi you were studying, di ba? Kidney, yeah, I think it's also the kidney because I was afraid, no? Siguro kasi nandun ako sa 19th floor, so medyo kondo ng friend ko. Tapos, yun din siguro, nagkasabay-sabay. So you need to know, no? You see the connection, so you can have that, no? So yung pasyente ko kanina, she had stomach issues, so I need to treat the stomach. So kasi wala naman ako nakitang ano. Sabi niya yung throat niya. Kung nilagay ko siya dito, round 23, para masigurado. Okay, number 30.
Number 30 po. Thank you po, Doc, for the storya.
Okay.
Number 30, the channel distributing to the cheek include po I have to answer kasi.
Especially when you do oculift. Have you done oculift? Facelift. Do you see the connection, Dr. Sam? Dr. Sam is enjoying this.
Yes, Doc.
The same thing. When you want to lift the cheek, you have to know the stomach, like, if you want to be like amazing, although I'm so, mas maganda kasi yung charging natin pag mukha, di ba? Yung sa ear kasi ang hirap-hirap hanapin is mas mura. But anyway, stomach, small intestine, large intestine. You have to know. Remember LI20? Yes?
You
should not
stomach 1, stomach 2,
yeah.
stomach 4, 5.
Also the SI. SI, remember? SI 18? Now you know. Di ba gusto ng iba mag-lift talaga yan? Okay. Thank you very much, Sir Michael. Good job.
Thank you po, Doc.
Okay, let's go now to the next one. Can I call on Dr. Sam, 31 to 40.
Okay, try ko, Doc. Matagal ako nawala sa circulation.
Parati ka naman nasa...
Okay, the channels linked with the eye system include, I think, 31 is the liver channel.
Only the liver channel?
Uh,
Remember, what is found in the eye? Like, why do some ophthalmologists look at the eye? Diba? We do we examine the back of the eye. We use a fundoscope or ophthalmoscope. We always observe the vessels there, right? And what controls the vessels? Grabe na yung feedback.
actually, liver,
And
spleen,
no, not the spleen.
the
No,
heart. No, sorry,
heart
it's
channel.
the heart. Heart
No,
channel.
the answer is 2 and 4. Letter
2
C.
and 4, yeah.
Number 32.
Besides the kidney and bladder, the kidney channel is linked with the heart.
What else?
The kidney is linked also with the spleen.
Are you
No,
sure?
lungs. I'm sorry. Heart and lungs pala. Sorry.
This is a repeat, di ba? Hindi kasama si spleen.
Hindi kasama, yes.
Pero did you know?
Kidneys, the liver, heart, and the lung channel.
Yeah. Pero did you know dependent po si spleen kay kidney yang, di ba?
Yes, correct.
But they're not connected. The channels are not connected. How that happens? Yeah.
Ano yun, Doc?
How it happens, so we don't really know. Number 33.
Yan nga, Doc. Actually, yan yung i-question ko sa'yo na, di ba, in the absence of the yang of the kidney, the spleen could not function like the transformation and transportation. But why is it that they are not connected? Siguro, yan talaga yun.
Ganun talaga, wala lang silang connection. Pero I think ang may kinalaman talaga dito is the one that is involved in the distribution of the irrigation, the triple burner.
Triple burner, yeah. I think so.
This is what connects everyone to everyone. Okay. Number 33.
The channels distributing the chest and abdomen, distributing the chest and abdomen. I think it's the stomach channel, the liver, and the spleen.
Not only. Kanina we mentioned about 0.5 zone from the midline. So the answer should be?
The stomach, 1, 2, 3, and 4.
Yeah, all. Kidney, stomach, spleen, liver.
Kidney, stomach, yeah.
Number 34. Very easy.
This the channels linked with teeth include, easy pa yun?
Kanina lang yan, di ba?
Large intestine and the stomach channel.
Okay, 1 and 3. Letter B.
1 and 3.
5.
Okay. The channels distributing to the ear.
Repeat again. Repeat.
Oo nga. Ano ba yung distributed?
Yeah.
It's
Sinagot ito ni Sir Michael kanina.
It's actually, teka.
There should be 3.
The hand Taiyang.
Okay. Hand Taiyang, what channel?
Small intestine.
Okay.
And then we have the
Taiyang.
The foot Taiyang. So the foot Taiyang is the bladder. And then we have
Han Shaoyin.
The Han Shaoyin. The gallbladder channel. No, the Han Shaoyin hindi pwede.
Okay, the bladder.
Triple
the bladder channel,
yeah.
because diba, it's supposed to be bladder and small intestine. So this is actually very, very tricky, no? So foot Taiyang. Kasi ang bladder, same polarity as the small intestine. Diba?
Yes.
Number 36.
The channels distributing to the forehead. Forehead? The channels distributed to forehead.
Yeah. Actually, pag gutom ka,
distributed the forehead. We have the stomach, the foot Yang Mei? No, the stomach channel. Teka, ulitin ko Dok ha. The
So
channels
what is your
distributing
answer?
to the forehead. Forehead. It's the
Mhm.
liver channel, I think.
Yes.
Mhm. The liver channel
What about
and this.
forehead? Masakit yung dito, frontal, lalo na pag gutom. So you have to include the stomach channel
Stomach channel.
and also the bladder channel. It's somewhere
Yeah,
here.
it's
Di ba sa bladder?
bladder, liver, also frontal.
Yeah.
Yes, Doc. The stomach channel, liver, and the bladder.
What about the
Meron ba
large
ako din?
intestine? It does not reach the forehead. Right?
Hanggang ano lang large intestine, Doc eh. Yeah.
Okay.
Hanggang nose and the
Number
channels entering the lung includes the lungs. The channels entering the lungs.
Mhm.
Hindi ko na alam ah. Entering the lungs.
Yeah. Actually,
See.
kaya this
Sige,
is
Doc.
the reason why pag mayroon kang lung issue, affected din yung isang channel eh.
The channels that they enter in the lung includes that is actually the kidney channel, the pericardium channel also.
Are you sure? Will it
Yeah.
include the spleen?
Oo nga pala.
Pasok sa lung ang
So,
spleen.
si spleen. Di ba Doc ang
Same polarity?
oo,
Yeah, same polarity,
spleen.
but that's as far as polarity is concerned. But they're not, when it comes to entering the channel, wala sila, they're separate. Same thing with the kidney and the small intestine and the spleen. Anyway, it's so obvious na pag may problema ka sa lung, affected in the heart. So we have to include the heart channel here. So, and of course, the kidney channel. So the answer should be...
The answer should be 1, 2, and 3.
No, 1 and 3. You don't include the spleen.
Why? Spleen.
There are two
Okay.
separate, okay?
Oh,
Heart and
okay.
kidney. Heart, kidney, lungs. Kaya ganun talaga, 'di ba? Pag may lung issue ka, remember the lung and the kidney, like pag nahirapan ka mag-inhale, lalo na pag may edad na, nahihirapan sila mag-inhale, so nagiging parang asthmatic sila because the kidney is supposed to anchor the chi. But if your kidney yang is deficient, kidney chi is deficient, then that will not happen. So
how about the pericardium, Doc?
Pericardium.
no, the pericardium is out of the alam mo naman ang pericardium, medyo it's supposed to just protect the heart.
But physically, they are actually
You have to
connected with the lungs.
the pericardium is more of emotions. You have to, kaya may kakaroon ka ng chest pain or especially yung mga babae na kinikimkim yung galit, nagkakaroon ng mass sa upper outer quadrant. And if you remember, that is actually the first point of the pericardium channel, right? Yeah. So
okay.
It follows the
So it's
course
the
of
heart and the kidney.
Yes. Number 38.
Okay.
I think this was
Number
asked
38.
before. We just wanted everybody to memorize this.
Yeah, the indications, the points of the 3 ion channels of the foot have in common are number 1, we have mental illness, so disorders of the eyes.
Yes.
And then febrile diseases.
No. That's young channels.
Sorry. disorder of the ears, mental illness, disorder of the eyes, and then
The three young channels are the gallbladder, the bladder, and the gallbladder, the bladder. The stomach. Remember?
stomach.
So the answer should be mental illness and febrile diseases. Diba? We usually use these are young channels eh. So pag uminit,
Oo nga pa.
ganda siya. But for disorders of
Kasi
the eyes, we would
this is the liver,
rather deal with the
Yeah.
yin channels.
the yin organs, yeah, the liver. Okay.
Okay, number 39.
The indications to point the three channels of the hand have in common are three channels. No? So disorder of the
Three young channels of the hand are the large intestine, the tripod burner, the small intestine. And I think it's common knowledge that
Number
the
one.
SI, remember SI6?
Disorder of the head.
Good for the aged,
Mm.
nourishing the aged.
So the first answer would be disorder of the forehead, face,
No.
nose, and bakit do? Di ba LI4 is any disorder of nasa head natin, like the face, and that is young channel.
But in common, ibig sabihin, lahat ng channels na yon, no? The gallbladder, the large intestine, the gallbladder, the large intestine, the small intestine, and the
Stomach.
triple
The
burner.
triple worm.
In common, lahat sila.
Yeah. Febrile diseases.
Yeah, febrile diseases, definitely. You
Ah,
can
yeah.
use the
The number
LI,
4.
you can use the triple burner,
Letter D.
also the SI. Remember? Febrile diseases. Di ba pag ano, like yung SI, pag grabe na si fire, si heart, okay? So also we use it for the throat and also the eye. So it's true that you can use it for the forehead, but remember, wala doon si ano eh, wala doon si triple burn.
Oo nga, wala triple burner.
So ang tanong kasi dito, in common. Okay?
I see.
So tinanong na ito before, I just wanted everybody to really
Take note.
number 40.
The indications, the points of the three yin channels of the foot have in common. Ano bang meron? Sorry, Doc, ha? Kasi
Sige lang.
wala talaga sa
Yin
business
channels
for
of
the
the
past.
foot are the kidney, the spleen, and the liver.
Yeah, kidney, spleen, and the liver. So obviously, kung spleen and liver or liver, we have also the eye, and we have also disorders of external genitalia. No,
pero when you say the eye, walang kinalaman si spleen.
Wala.
How about the liver? Common,
Yeah,
sorry.
Kidney, spleen.
Ulitin natin, Doc.
Okay, the answer is?
Okay. Part doon is mental illness. 1.
Are you sure? No.
Hindi, kasi di ba kidney?
Mental illness is mostly heart, spleen. Di ba? That's already misting the mind.
All right.
Phlegm, mind, heart. So
dalawang answer ko dito, Doc. Kung hindi yun, so we have number 2 and 4. Yeah, number 4 is gynecological diseases and
Yes,
disorders of the
definitely.
external
Liver, kidney,
genitalia.
spleen, and external
Mm.
genitalia, 2 and 4. Thank you very much. Medyo pagod lang si Dr. Sam. Ang dami yatang pasyente kanina. But anyway, thank
Hindi,
you
Doc,
very much.
stress lang ako.
Sige, prepare for more stress. Let's get this done with. Okay, let's now call on sino pa ba?
Si Doc.
Okay, balikan natin.
I'll-
Ay, Ma'am
I'll
Lynn.
try, Doc.
Ma'am Lynn.
Okay.
40 to 50, yes.
41.
41 to 50.
Number 41, Doc.
Okay.
Okay. The
Yin
indications,
channels.
the points of the 3 yin channels of the hand have in common are disorders of the chest, Doc,
Yes. Pericardium. Diba na si chest
the
pain,
heart,
na? The heart, of course, and also the lungs.
lungs.
Isa
Yeah.
lang ang sagot dyan.
Disorders.
42.
Number 42. Which of the following points should be punctured with the patient's mouth open?
Okay.
Ang answer Doc 1, 2, and 3.
Okay.
Sancho 21, SI 19, and gallbladder 2.
Okay.
Kasi yung stomach 6 nasa mandible na po yun eh.
Opo. Tatlo lang talaga. And everybody
Mm.
should memorize this. Number 43.
Number 43. The indications of bladder 57 are lower back pain, spasm of the gastrocnemius, and hemorrhoids. 1,
Okay.
2, 3.
Yeah.
Okay.
You don't
Number
use it.
40 for dysmenorrhea.
Dysmenorrhea.
Parang
What is the
malayo,
good point for dysmenorrhea?
liver points.
Okay. Very good. Number 44.
Number 44. When bladder 1 is punctured, which of the following things must be done? Lahat po to, Doc. Ask the patient to close his eyes, push the eyeball gently to the lateral side, puncture slowly, 0.3 to 0.7 inch perpendicular along the orbital wall, and refrain from twisting, lifting, or thrusting the needle.
Okay.
All of
Yeah.
the above.
This is the best time to use the guide tube, no? Use the
Pero
guide tube.
nakakatakot pa rin. Ako katugusok ng mata.
So, ano natin to sa exam? Practical.
Oh!
Okay. It will be ruffled off. Okay.
Pwedeng GB37 na lang daw.
I want po.
I think ginawa ito ni somebody messaged me about it. I think she did it right. Wala.
Si Kati,
yeah,
Doc,
oo,
actually
si
ginawa
Kat.
namin.
Yeah. Yeah, oo. Congratulations. Yun ang talagang, hindi naman namula yung mata, no? Just made sure
Wala naman, Doc.
humingin siya sa pinakamalayo laterally. Come on. And then just,
Ako yung ginawang
ikaw yun?
Kayo yung Dr. Sam.
Ako yung Doc.
Okay. Congratulations. Very good. Number 45.
Okay, not
You have to
45.
do it. Okay, number 45.
Number 45. Which of the following points are at a level with the umbilicus? Lahat din po to, Doc. Stomach 25 is ka-level din ng umbilicus. GB26,
Yeah.
nasa siya, lower end of the 11th rib, nasa free end, pero ka-level siya ng puso.
Okay.
In 15 is 4 tune lateral to the umbilicus. In kidney 16 is 0.5 tune lateral to the umbilicus.
Okay. You remind me
Okay, lahat
later, I have to be reminded to give you the points on the same level.
Parang
You
binigay
need
niyo
us to
na yan sa amin
enumerate
dati,
all the
Doc.
points.
Module 1 pa lang.
Okay.
Yung
Pero
points
binigay
at the
ko na
same
yan
level,
eh.
parang
Binigay ko na
week
yan.
9.
Yeah.
Yes po. Week 9
Binigay
of
ko na
module
yan.
1. Binigay niyo
Walang
na.
pumansin. Okay,
Doc,
40.
wala pa po kami, Doc.
Wala pa ba?
Po,
Meron na kanina.
bigyan
Sige,
na lang
sige.
po kami,
Magbigay
Doc.
ko mamaya.
Thank you po.
46.
46. Which of the following points are at the level of the lower border of the spinous process of the 11th thoracic vertebra? Ang answer ko po, bladder 49, do 6, and bladder 20. Kasi yung bladder 48, nasa 10th thoracic vertebra yan siya.
Okay.
1, 2, and 3.
Your ano dito is bladder 20. Add 29, that's your outer back shoe, bladder 49. And of course, do 6.
Outer back shoe, bladder 49.
Number 47.
Number 47. Which of the following points is at the level of bladder 15? Ang answer ko po ay do 11 and UB 44. Pareho
Okay.
nasa 5th thoracic level ng
Very
5th thoracic
good.
vertebra.
15 plus 29. Next, number 48.
Okay. 48. Which of the following points are contraindicated for both acupuncture and moxibustion? Ano na? Yung REN 8 and REN 5, pagkabuntis, bawal po sa acupuncture. And yung REN 8 definitely bawal sa acupuncture, pero pag buntis, bawal din sa moxibustion. REN 5 din. And stomach 17 po, bawal both in acupuncture and moxibustion.
So,
Sa nipple po yun, di ba?
so your answer is
Stomach 17.
okay. Both acupuncture and moxibustion. This is a bit tricky, huh? Just don't think of acupuncture alone. REN 8 kasi, bawal lang acu, pero you can moxa. Yeah, very good. The answer is, bakit?
Stomach 17.
Nasaan ba si stomach 17?
Nasa nipple po yan, Doc.
Okay. 49.
Which of the following points would you select to treat several diseases?
Okay.
Do 14 and LI 11.
Okay, very good. What is the reason why we use LI 11? It's supposed to be a tonifying point. That means, diba? So in this case, you need to tonify it. Para mabilis siya
Pag
mangyari.
tinonify mo yun lang, mas mabilis, mas ma-reach niya yung peak ng yang, so magta-turn into yin.
Very good.
Tama
Number
ba?
50.
Number 50. Channels distributing to the tongue are the spleen and the kidney channel.
Okay.
Tama ba?
Congratulations,
Okay.
Ma'am Lynn. Good job.
Okay.
Let's call again. Nawala na yung iba. O sige kayo. Let's go to Ma'am. Miss Joy, would you like to answer?
Dok, wala po akong sagot dyan sa
Okay.
half lang po yung halfway lang po yung nasagutan ko.
Would you
Sorry
like to
po.
try?
Ang hirap po, Dok eh.
Sige.
Ang dami ko po natututunan sa kanila, kaya
Sige.
pwede po bang makinig na lang
Ang
ako sa
galing nila, no? Ang gagaling
I
nila.
am taking notes.
Okay, let's call. Ay, nawala si Sir Vic. Na turn off yata. But anyway, let's call back Ma'am Angel call. Good evening ulit, Ma'am Angel. Time to redeem yourself. Okay.
Good evening, Doc.
Sige, 51 to 60. Good evening ulit.
Good evening po ulit. 51 po. The point for treating facial paralysis include stomach 6 and stomach 4 po.
Okay, very good. Yeah. Memorize that. And also LI4. Napaka-effective. Next, underline the part of the statement which is incorrect. So I'm sure sinagot nyo na to. Let's go to number 52, Ma'am Angel. Alin mali?
Ang tingin ko, Doc, yung constipation.
Yes, very good. Maganda siya for difficult labor, headache,
And nasal
obstruction. Wala
obstruction.
siyang impact sa constipation.
Okay.
Okay, nasal
Pero
obstruction.
Doc, nakakatulong siya, Doc. Kapag maghihirapan
Constipation.
Yes po, yan yung pinipisil ko pagka nahihirapan ako mag-move ng bowel.
Ay, baka taga-ibang planeta. A joke.
Kasi naisip
At
ko,
least it
pa
worked.
turn
At
yung
least
baby pag pag
okay.
na-stimulate yung UB67, sinubukan ko lang.
Ay, wow.
So effective siya sa akin.
Congratulations. Nag-work. Okay, let's go to number 53, Ma'am Angel.
Number 53, Doc. Ang tingin ko po is yung cardiac pain po.
Yes. At saka abdominal distension.
Yes po, Doc.
Okay, 54. Bladder tank.
54 po. Urinary bladder gland. Ang ano ko po, Doc, is yung appendicitis, diarrhea. Parang, hindi po, Doc.
Hypochondriac pain.
Okay. So, pwede po siya sa appendicitis, Doc?
Hypochondriac pain. Yeah, pwede siya sa
Okay.
appendicitis for the pain.
Okay po, Doc. Thank you po.
Kasi malapit po siya sa ano. Okay.
Thank you
Next,
po.
55. Ano mali
55
dito?
po. So 55 po is toothache po, Doc.
Toothache. Very good. Hindi kasama si toothache.
Opo.
56.
56 po is
LI11. Ano yung pwedeng kasama dyan?
LI11 po is mania.
Ha? No.
Um,
Maraming heat. Di ba mania talagang
okay. Ano po? Yung urticaria po, Doc.
No. Urticaria is
Ang allergy nga yan eh.
may heat yan eh. May
Diba
heat
allergy yan, Doc?
allergy. Urticaria. May mga hives ka. Maganda ang LI11 dyan. Ano yung out of this? Diba palpitation?
Palpitation
Heart.
pala.
57.
57 po. Stomach 44 kay
Anong hindi kasama dyan?
si cough. Ay, hindi. Si
Yun
ano
na.
po?
Kung ano
Tama.
yung sagot, yun na.
Ay, sorry, Doc.
Yun yung
Nalilito.
ginagamit sa stomach 44 sa cough.
Opo,
Tama?
kasi kay ano siya eh, kay toothache and
Yeah.
stomach. Yes, Doc.
58.
58 po is hindi ko
Spleen
siya
3.
ginagamit kay sunstroke. Kay
Yeah,
sunstroke.
sunstroke. Hindi mo siya ginagamit sa heat. Sunstroke.
Yes,
59.
59 po is
7.
hindi siya ginagamit, Doc, sa cough
Saka,
and sprain.
yeah, lumbar sprain. Yes.
Opo.
True or false? Ikaw na tong 60 and 61.
Dumudugo na. 60, Doc, is spleen 2 is the U1 source point. False po kasi ang U1 source point po is spleen 3.
Very good.
Spleen 3.
And spleen
Tapos,
4?
spleen 4 is a low connecting point po siya.
Okay,
Yes, true po.
galing. Maraming
Thank you.
salamat, Ma'am Angel.
Thank you,
Na-redeem mo
Doc.
ang sarili mo.
Sorry, Doc.
Congratulations ulit.
Thank you
Let's
po.
call on Ma'am Ami Glorioso for 62,
Okay, Doc.
70.
Number 60,
62.
62. Bladder 60 is the U1 source point of the urinary bladder.
True or
This
false?
is or false ang answer, Doc, no?
Anong
True or false?
yuan source no?
Ang 62 po is the bladder 60 is false po, Doctor.
So anong yuan source point niya?
Ang U1 source po is 64.
Okay.
Bladder 64.
Can you give me a very good example of a case where you could use the yuan source point of the urinary bladder? Okay, this is very common po sa mga medyo maedad na, no? Just like a patient I had last Monday and Thursday. Actually, nakalimutan ko yung source point ng bladder. Okay, so tinan mo. So it's bladder 64, no? Yung mga may prostate problems. Okay? I'd like to share with you the history kasi you might have this kind of patient, you know, in your practice, no? Ang pasyente is 78, American, but he was born in Austria. Of course, married a Filipina. And nagulat siya nung tinanong ko, at what age did you stop wetting your bed? No? Alam niyo yung enuresis, bedwetting, that is a sign of a very weak kidney. Kasi sinabi niya sa akin, iisa na lang yung kidney niya. Nagkaroon siya ng kidney cancer at the age of 40. Okay. So ngayon, tinanong ko sarili, inaral ko, bakit siya nagkaroon ng kidney cancer? And so yung una-una kong tinanong, so definitely you have a very weak kidney. So sabi niya, he was 14 years old. So ibig sabihin, 12, 13, di ba mga 6 years old, hindi ka na umiihi sa kama. Ewan ko yung iba dyan kung nang iihi pa. Si Sir Michael kaya. Joke. So ngayon, I asked him, kasi I need to really look at ako kasi, when I see patients na katulad nitong pasyente, 78 na pala siya, 78. Inoperahan siya. So he only has one kidney left, no? He came because of his prostate problem. Alam mo ang risk ng prostate problem, yung hindi ka makaihi, so nagre-retain yung urine mo sa urinary bladder. So there's always a chance of infection, right? So again, we need to remember that the kidneys control the urinary bladder. But I need to find out bakit nagkaroon siya ng ano. So hindi man masabi ng doktor niya. So I asked him, okay, what else happened? So kapag nang ganun, bakit naiihi? Yung pala, he has a very, very traumatic childhood, no? Yung father niya talagang ano siya, sinusumpok siya, like yung child abuse, yung mga ganon. And even the brother would bully him. So until at the age, sa States, pag 18 ka na, libre ka ng, umalis ng bahay. Sabi niya, it was the first time na parang nawala, nakatakas siya sa impyerno. No? So, what is the point here? Yung ano niya talaga is he had a very traumatic childhood. He became a cop in the States, and then 2 failed marriages, and then at the same time, nag-retire siya at the age of 43. Yan. And alam mo naman sa States, maaga kang mag-retire as long as mataas-taas yung service mo. Okay, so now, he was so surprised why I had to ask all these questions. Nobody has asked those. In fact, actually, he was seeing another practitioner who doesn't even look at the tongue. So, kaya mura. So, sabi, so happy naman siya. He's very happy because tinanong ko one last thing. When was the last time na umiyak ka? Oh. Hindi na niya maalala. So, ibig sabihin matagal na. Sabi ko, sige, umiyak ka na umiyak. No? And forget the past. Kasi you only have one kidney left. Can you see the connection? The kidneys control the bladder, right? Alam mo, he felt so good. I don't know if it was because we were able to make him, tell us about his childhood. I don't have to know, no, kung ano ba yung mga ano doon. And when he was sharing his story, he was like crying, and I think he felt better. Even the complexion ng mukha changed. Okay? Yo. So you have to needle bladder 64, and of course you need to needle the front mu point of the bladder. What is the front mu point of the bladder? Naku, yan na. Ren what?
3.
Ren 3, very good. And you also need to, you need Ren 6 also to for the chi. They also needled Ren 4 and also Ren 12 because ang dami niyang dampness. And yun. Okay? Meron siyang dampit in the bladder. Amazing, diba? And it always makes me feel good every time I see changes on the tongue. Just like a patient kanina. So I hope you're able to get why are we doing these things? There's a big difference between someone who is just a practitioner and someone who is so passionate about his what he's doing. Okay? Because for me, diagnosis is very, very important. You will not get my respect if you don't even look at the tongue or even ask the stupid questions. Okay? So you don't have to ask so many questions which are like medyo ano. You just have to know the right questions to ask. Okay? So yun. Hanggang sa nagpa-aculift na rin. Okay, anyway, that's another story. So maraming salamat, Ma'am Ami. So the answer is bladder 64. Let's continue with 63.
Number 63.
Bladder 58.
Urinary bladder 58 is a jingle river point of urinary bladder channel.
True or
The
false?
answer, Doc, is false.
Okay, so what is bladder 58? What
Bladder
is Jing River Point?
The Jingwell River
Jing
Point is
River.
bladder. Jing River Point is unit bladder 60.
Wow, memorize. Diyos ko, tindi. Okay, number 64.
Number 64, LI10 is located 2 Chun below LI11.
Okay, why is this very, very significant? Every time you have a patient with shoulder pain, did you know that you need to know? Ako kasi pinapapili ko between LI10 and LI12. So, usually pag LI10 ang masakit, so that means I did the right thing. So, yun. LI10 is actually distal point ng shoulder pain. And I tell you, ang daming may shoulder pain. No? Yeah. 65.
Number 65, kidney 9 is located 6 Chun above kidney 3. The answer, Doc, is false.
And so, what's the correct answer?
Kidney 9 is 5 Chun
Okay.
above the kidney 3.
Ang galing.
The
Okay.
medial malleolus.
66.
66, stomach 21 is located 2 Chun lateral to ren 12 through the
True. Alam niyo maganda to. Binaligtad lang. Stomach 21, ren 12. And this is very, very effective for ano ba to? Also reflux. Yung stomach chi rebelling. Number 67.
67, kidney 10 is located on the lower border of the medial condyle of the tibia.
True or false?
False, Doc.
What's the correct answer?
The correct answer is lower border. Between the tendons of the semitendinosus and
Okay.
semimembranosus when he is flexed.
Yes. What is the classification of kidney 10?
Kidney 10. Kidney 10.
Ano siya? Anong klaseng 5-shoe point siya?
Ang kidney 10 po is kidney 10.
Kidney 10, is it
Kidney 10 po,
liver?
TC point of the kidney.
Very good. Yes. Number 68.
Number 68, large intestine 5 is the low connecting point of LI channel.
Yes.
False, Doc. False.
What's the correct
answer? LI6.
Okay, very good. 69.
69, the points GB14, UB2, stomach 4, LI4 are effective in treating facial paralysis through Doc.
Yeah. So now you know how to treat facial paralysis.
That's false.
Yes.
Where is bladder 2?
Sa outer canthus ng eye po.
Outer canthus? No.
Ay, bladder 2, di ba? Eh, nasa taas pala.
Nasa outer canthus? Hindi Outer...
Bladder 2 is near the medial end of eyebrow.
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 Meron ka mafe-feel na parang ano dyan, dear.
Parang,
Here.
parang dent.
Stomach
no?
4. Where is gallbladder 14? Diyan na. Paano tayo makatreat ng ano? Actually, gawin mo lang, tandaan nyo lang yung mga pinag-facial ninyo, ina-aculift. Matutulungan mo na.
14, 1 Chun above the middle eyebrow.
Yeah, okay.
Forehead, 1
One
Chun middle.
Nasa forehead.
Middle of eyebrow.
What do you call this point here between the eye, in the middle of the eyebrow? Diba you have your
Yintang.
this is
Yintang.
this one.
This one.
Sa taas niyan is your GB14. What do you call that? It's an extra point.
Extra point.
Hindi kayo nag-ano, aculift. Maraming ano to.
Yintang lang Doc ang ano.
Yuyaw. Yuyaw.
Yeah. Okay, Doc.
Okay. Di ba gagamit ka ng intradermal needle? Unahin mo dito.
Okay. Yeah.
Tapos dito, yan. Okay, go. 70. Ay, yeah, 70.
The three-inch channel of the hand run from the chest to the hand.
True or false?
True, Doc.
Very good. Thank you very much, Ma'am Ami. Good job.
Thank you.
Let's
Thank
call
you, Doc.
back Sir Michael. Sir Michael. Sir Michael.
Hello po, Doc.
Okay, 71 to 71 to 80.
71. The three young channel of the hand run from the hand to the head.
Mm-hmm. True or false?
Three young large intestines and small intestine. The answer for 71 is
True.
Can you
Hello,
give me
hello?
an example of a young channel? A hand. Just like LI. Paano ba? From the head to the hand or from the hand to the head? Sir Michael, what happened?
Nasagot ko lang po kasi. LI. LI.
True or
channel.
false?
True po, true.
Okay, very good. 72.
Oo. 72, the three young channels of the foot run from the head
To the
foot. The foot.
Example, stomach channel.
Hmm.
True or false?
Stomach,
Head to the
from
foot.
yung
True.
may portion
True yan. From the nose to the
nose. To ano
to the
bang
toes.
No, true or false?
True.
True. Okay, tagal. Alam mo niya ang sagot. Okay, next. 73.
nasagot ko, Doc. The three young channels of the foot run from the foot to the head.
Okay, true or false?
True po. Begin at the foot and travel along the inner surface of the leg, the chest of flank. So, true po to, Doc.
Are you sure? Okay.
Wala ko dyan, Doc.
Sure ka or not sure? Sagot mo true. Does everybody agree?
False, Doc.
False.
False.
I think you like this kind of question, true or false, but you have to justify. Why is it? Joke lang. Maganda to, di ba? Maganda, di ba? Very easy. Ay.
False.
False. Okay,
False.
Sir Michael, can you tell me saan nagtatapos ang spleen channel? Di ba spleen channel, yin channel yan of the foot? Umaabot ba sa ulo ang spleen?
Hindi po.
O bakit mo sinagot ng true?
Sorry po.
Saan nag-end? Okay, sige. To redeem yourself, ano ang last point ng spleen? Pakita mo yung mukha mo, di mo na pinapakita.
Sorry po. Sorry.
Ano sagot mo? Go. What is the last point of the spleen? Kaya mo yan. Oh my God, kaya mo yan.
Kinabahan na.
Okay, kidney. Sige, another chance. Kidney channel. Sa anong point? Last point.
K1 po. Nasa kidney 1.
No, the last point. That's kidney 1.
One last point.
What's the last point of the kidney channel? Umaabot ba sa ulo?
Hindi po, Doc.
What's the last point? And you have to demonstrate where it is.
Hindi po alam.
How many points does the kidney channel have?
Hindi lang po, Doc.
Okay. Assignment. Liver channel. Okay, who would like to answer? Kidney channel, ilang points?
27.
27.
7.
Okay. What about the spleen?
21.
21.
21. What about the liver?
14.
Okay. Umaabot ba sa ulo ang liver? Okay, sige.
Sa chest lang po.
Yeah, number 74 to 77. Sir Michael.
74.
LI1.
LI1 is often used to inpatient with insomnia,
True or false?
false.
Okay.
Number
Lumbar
three,
pain.
false also.
Toothache.
Toothache, yes.
No.
You know. False
You use
toothache.
LI11 or LI4. LI11, LI4. Okay, sore and painful throat. LI1 ito hindi lahat ng LI pwede mong gamitin sa lower teeth. Okay. Sore and painful throat, yes or no?
True.
Okay. Why?
You know. So true. So connected po kasi sa
No,
ano to,
anong classification ng LI1? Remember, this is a young point. So, nag-uumpisa sa
sa daliri. Sa
metal or wood?
Hmm.
So, this is a metal point. Metal is lung, di ba?
Lang.
Okay. 78. True or false?
78. According to the therapeutic principle of acupuncture, one should use an excess and tonify a deficiency.
True or false?
True po, true.
Can you show us how to... never mind. Sa practicum. Ginamit mo ba yung tonification?
Ang excess po kasi talagang kailangan i-reduce to understand.
Of course.
So,
79.
79.
True or false?
79, there are 27 points of yung pinag-usapan. 27 points of the kidney channel. True.
Yes, very good. Number 80.
80 points on the lung channel are indicated in cardiac, gastric, and mental disorder.
True or false?
False po.
Okay, good. Thank you very much, Sir Michael. Medyo nadagdagan ng points yung pag-ano mo. Read more.
Read more.
Sino pa ba? Last na po ito, no? Last batch, if I'm not mistaken. So we go to Dr. Sam once again to end this evening. Dr. Sam, please. True or false?
Okay. Hopefully, makaya natin to, Doc.
Kaya yan.
Okay. The course of the small intestine channels runs on the radial aspect of the little finger, while the heart channels runs on the ulnar, radial, ulnar. Yeah, that's true.
Do you want to reconsider your answer?
Baligtad
Ano, Doc?
po.
Teka.
Baliktad.
Radial. This is radial. This is ulnar.
Okay. Saan ba si radial? Palabas or using the anatomical position? Nasaan si radial?
This is radial.
Papunta
Yeah,
sa
this is
pulso.
radial. This is the
Okay,
ulnar.
pag pag naka-anatomical ka, yung nakikita natin sa mga anatomy chart. Nasaan si
Okay, sa
radial?
labas.
Palabas o sa loob?
Sa loob po.
Loob.
Sure?
Inner po ang radial. Diba dito? Ay, ganun ba?
Sa labas.
Wala, labas pala. Ito pala sa labas.
Ulnar,
Parang
yan yung
ganun yun.
medial.
Sige. Okay. 81. Ulitin natin. The course of the small intestine, kasi nalilito ako sa paggaganun, Dok, eh.
Yeah.
On the radial aspect of little finger. So, small intestine, di ba dito sa radial? Ulnar.
Ulnar na siya.
And then the heart channels runs in the radial. So,
Baligtad.
well, the just has
Huwag masyadong
baliktad nga to.
mag-isip.
So therefore,
Isipin na lang
this is
yung...
false.
Yes. Number 82.
Ah. Okay, the poinsanteria or spleen cyst is located 3 tune above the... Yes, this is true, external malleolus.
Would you like to reconsider your answer?
Mhm.
6 man. It's 3 tune above the...
Are you
Ah, no,
sure?
internal malleolus. I'm sorry. Internal malleolus pala
No,
daw.
no.
Sorry, external
Yeah.
malleolus.
Okay.
Above kidney channel ba yan?
Be careful.
Sige.
Be careful.
This is external
Medial
malleolus.
malleolus or internal malleolus.
Internal, that's lateral. Isa.
You like this
Okay.
kind of question? Okay.
Yes, no? It's very tricky.
Yeah, number 80. So expect a very tricky question.
Grabe daw.
Okay, go.
P9 is pericardium 9. Is indicated in chiralgia. My answer is true.
Are you sure?
Yeah.
Yeah.
Is it indicated for pain? Pain ang chiralgia is
Pain and numbness.
pain and numbness. Do you use pericardium 9?
Di ba siya pwedeng gamitin?
Actually,
Parang
maganda
pwede.
siya for compression of the median nerve, remember? False.
Pwede siya,
Pwedeng,
Dr.
what is the purpose of pericardium 9? Wala daw.
To remove the heat.
Yeah, this is for high fever pala, no? And
actually, you have to believe that you don't bleed a neuropathy. Neuropathy kasi ang chiralgia. Wala ka na i-bleed sa neuropathy, except, di ba? Yung pericardium 9 yan eh. Fire point.
Dulo.
Fire point. Hindi, wood point.
Wood point.
Next.
Okay, 84. Bladder 43.
43.
Oh, saan ba bladder 43?
43 minus 29, ilan? You would know sino yung katabi. That's an outer back shoe eh. 43 minus...
Deficient syndrome.
22.
Pwede check ko muna, Dok.
Bladder 14.
Oh, bladder 43.
So bladder 14 is yeah.
Deficient.
Deficient or excess?
This is for...
Okay, ganito lang. Generally.
Kasi bladder naman yan. Diba,
Yeah,
generally
what do
for
you use?
deficient.
Yeah, what do you, deficient talaga.
For weakness.
So we
weakness.
always tonify that. Okay. So true or false? True, right? 85.
True, yes.
Bladder 52.
Bladder 52 is indicated for impotence and involuntary emissions. Yeah.
True?
That's true.
Very good. Did you have any experience with that? With your patients?
Wala pa, Dok. Wala pa, Dok. Meron lang akong notes niyan.
Okay, 86.
86 for stomach 29 is indicated for disorders around reproductive system. The answer is false. Diba stomach 29 is for...
Did you check?
Common sa akin yung mga points. Okay.
Yeah. Actually, maganda siya for uterine prolapse. So, maganda siya for reproductive system. Ang tanong, nasaan ang stomach 29?
Ka-level ng CV3 po, Doc.
It's actually
fortune
level of CV3.
umbilicus.
Fortune below the umbilicus.
So, it's very good for the
lateral.
reproductive lower abdomen yan eh. Diba?
True.
Okay, that's true. 87?
Deep deep insertion cannot be applied at the point UB or bladder for 43.
I think this is very easy. True or false?
True.
Remember,
Very easy pa
yeah.
po. The deep insertion that is
True
bladder
yan.
43. This is
Can you needle it? Hindi ba pwedeng i-deep?
hindi pwede, Doc.
Okay.
Makakatama ka
So
naman.
the answer
The
is
The
pericardium
answer
lies
is
beneath.
yes. Very
false.
good. Unless you want to
Tatamaan
be
doon.
the patient. Okay, number 88.
The 12 regular channels all pass through or close to the throat. Therefore, all the regular channels have points effective in treating sore throats.
Oh my God, lahat pala, no? True or false?
Lahat ng channels? False. Ay, teka. Regular channels all passes through or close to the throat. All regular channels have points effective in sore throats.
Yes.
True or false?
Kung dadaan sa throats, it's very useful.
Answer is
That's
true.
true.
Okay, ngayon ko lang nila. Okay, number 89, the last one. Very
Number
easy.
89. Utilizing the theory of reinforcing mother for deficiency syndrome while reducing the son for excess syndrome. Heart 9, kidney 1 can be used to treat insomnia caused by deficiency of heart yin. Heart 9?
Okay.
Deficiency of heart. Okay. The answer is ano, Doc? The answer is true.
Okay, very good. So thank you very much everyone for joining. I hope
Ay, Doc, wait po.
sige po.
May question ako kasi 'di ba yung para ang naintindihan ko dun sa napanood kong video, tonify the mother ng affected meridian, tapos tonify mo din yung mother point ng sun meridian kung magto-tonify. So ang sun ng heart ay ano ba? Hindi ba liver ang hindi nalito ako
Same
bigla.
meridian. Same
Parang
meridian. Kasi every meridian meron tayong unification.
Wood ang
Meron tayong
di ba,
other.
Doc?
Oo.
So
Okay.
heart 9 is wood. Ang kidney 1 is
Just like for example,
wood din.
yes. So basically, pag sinabi mong okay, heart 9, it's you're talking about the same the same channel, no? So heart 9 is supposed to kasi dito you treat insomnia caused by deficiency of heart yin. So that means you have to tonify the pag deficiency kasi you reinforce the
The
mother.
mother point of the
So
fire.
the mother of the heart is what?
Is wood.
The wood. So you have to
The
look
mother
for
of
wood point.
the wood point
point
of heart
of the heart. The wood point of the heart is heart 9. Diba? The far point is heart 8. So for excess syndrome, you have to sedate the sun. So in the case of now this one,
deficiency.
yeah, the sun is deficiency to. So this is actually kidney 1 is a sedation point of the water element of the kidney.
Hindi ba siya Doc? Ito tonify din yung mother point ng fire meridian.
Bakit mo ito tonify yung mother point ng fire meridian? Kasi dapat i-ano mo yung excess, i-sedate mo yung anak. Ang anak nito, kasi we're talking about the theory of reinforcing the mother while reducing the son excess syndrome.
So
Now,
this one
this
is a
one is
deficiency,
heart yin
diba, Doc?
deficiency.
Deficiency. So we tonify
We're
the
not
mother
talking
point.
about heart fire here. So if it
Yeah.
is heart fire,
Tama.
it's time to... Kasi ang ano dito,
Kidney fire.
yes.
So tonify
Ano
the
ba ang
mother
kidney
point.
1? Ano ba ang kidney 1?
Kidney 1 is the wood point 1.
Kidney 1,
Child.
being a yin point, is the wood point.
Yes, the wood point of the
So which makes sense.
connect ng heart sa kidney.
Diba? Wood point ang kidney 1.
Yes.
So that is still the mother.
Mhm.
Mother siya. Ang pinag-uusapan dito is heart yin.
Mhm.
Any comment, Dr. Song?
Iniisip ko kasi, Doc, yung mother point ng ano, ng heart. So,
Mother point ng heart is wood.
yeah,
And
po, kaya
kidney
nga po,
1 is a wood point.
kaya
No,
inisip ko yung...
kasi kidney and the heart
kidney.
are like...
Kaya inisip ko po yung liver. Kasi
No.
yun yung mother point, mother ng heart ang liver. So, isang point niya, parang yung wood point ng liver.
No, the wood can be called the... Wood is already liver. Pero
Yeah.
it can be translated as wood point. Do you follow? Kasi
Yes.
remember, mahina yung heart mo rito. So you need to like sa totoo lang kailangan mong i-ano yung yin. I-tonify mo talaga yung yin. Insomnia caused by deficiency of heart yin. So that means you need to tonify it. Do not be confused about, kasi you know it makes sense because the kidney 1 is actually a wood point. If you follow the principle, like this is a yin channel, no? Kidney 1 ang pinag-uusapan. So kidney 1, you consider it as a point kasi it's the first point, diba? It's called the Q12 point or the wood point because it is a yin point, yin channel. Which makes sense because it is the mother. Wood is the mother of the heart or the fat. The same thing with heart 9. Heart 9 is the far point. No, I'm sorry, the wood point.
The wood point of
the heart channel. Okay, yung iba dyan. Any comment? Are you more confused, Dr. Sam? Ganun lang yun. It's still 5 elements, no? Ito kasi, this is actually the theory, as a general theory. We're not actually, in this case, the example is deficiency of heart yin. Okay? So this is a deficiency condition. So when in cases of deficiency, you have the option to treat, like, do not be misled by, okay, so definitely, heart is a fire. Kulang siya. Kailangan mo siyang i-tonify yung po ng mga wood points. It can be on the heart channel itself or it can be outside the heart channel, as long as it's a wood point.
So any wood point pwedeng i-partner sa heart 9, Doc? Or kailangan kidney
As
talaga
long as
siya?
it has connections
Kailangan
with
kidney 1.
the channel. Kaya diba, like there is a heart and kidneys, they have to communicate. Okay? There are people na hindi talaga makakatulog. Remember, this is heart yin deficiency, wala nang coating. So there is a tendency for this to become heat, diba? Empty heat. Saka kulang siya ng yin. So ito tonify mo yung organ itself. And how do you do that? You have to use the wood point. So you just don't choose any channel. Because the
Yes.
heart and the kidneys, they communicate. Diba? In fact, we use it
Yes,
as a basis. Like, if you look at the tongue, pag yung tongue ng isang tao, masyadong mahaba. So that's too much heart fire. So that means kulang talaga yung water component niya. There are also people na napaka-putla ng tongue. So kulang talaga yung fire component niya. Okay? But this one is also a deficiency condition. It has no coating. That's heart yin deficiency. So that means you have to tonify the yin. So you'll have to be able to connect to, you have to consider the yin channel. Pero hindi lang basta-basta channel. You have to use, it's up to you. You can use heart 9, you can use kidney 1 because both are wood points.
Naisip ko lang po kasi yung liver, kasi yun yung, di ba, parang yun yung mother point ng heart. So, liver 1 and heart 9, yung aking combination.
No, kasi it's usually a water and fire.
Okay.
Water and fire.
Kasi po, yung deficiency kasi to, so that's why kidney 1 is the right point to tonify.
Okay.
The liver here is represented by the wood point. Wood point ito lahat eh. Heart 9 is the wood point of the heart channel. Kidney 1 is the wood point. Now, if I look at the liver, if you lalagyan mo siya ng ano, like if you tonify the liver, which also
magdadagdag ka ng fire.
Magdadagdag ka ng
Hindi po, liver 1 po, Doc, ay wood. Wood din yung liver 1. Diba?
Yeah, liver 1, spleen 1, wood din. But for yin deficiency, I think the one that controls the fire is kidney 1.
Kasi in the clinics kasi, di ba pag may heart problem ka, there's tendency for you to have a weak kidney talaga. So it's water and fire yan eh. They need each other. They need to, it's a give and take situation. Yes. So we will only be dealing with the heart and the kidney, but we consider their wood points, which makes sense naman.
Or maybe ma'am, you're thinking about heart 7, which is the earth.
No,
or liver 1.
Liver 1.
Liver 1.
Kasi parang yung sequence ng generating cycle ang sinundan ko, di ba?
Controlling kasi.
Mas generating. So, di ba yung wood generates fire. Kaya inisip ko yung mother point ng heart is the wood. So, doon na kumuha ng isang point sa liver 1. Yung wood point ng liver.
Ay, hindi.
Point ng heart.
Within the channel talaga. And dito, you can actually use heart 9 or kidney 1.
Ang ano ko, Doc, yung main point na niya, heart 9 talaga siya. Yung inisip ko lang ano yung partner niya doon sa isa.
Saan?
So, yung partner ng heart 9, yun yung nalito ako doon sa kidney. Kasi parang kung sa generating sequence, parang hindi magkasunod kasi yung fire.
Don't be confused with the generating sequence. In generating sequence, you talk about the elements. This one is about, for each channel, there is a correspond. Kaya meron tayong tinatawag na horary point. When you say horary point, like this is the heart, no? So you have to look for the far point of the heart channel. So ibig sabihin, pinag-uusapan dito is within the channel. So hindi mo siya i-connect sa ano. Since the heart and the kidneys, they always have to be in harmony. No? Water and fire yan eh. You have to only consider heart and kidney. Kasi if you remember, for liver, the tonification point is liver 2. Right? No, I'm sorry. Not liver 2.
Hindi po, liver 8 po.
Liver
It's
8.
one
Then
liver.
Liver
liver,
8.
what's the
Kasi
sedating point of the
nasa
liver?
liver 2.
Or liver 2, sedating
It's a
point.
fire point.
So do you think you would be able, liver 8, hindi siya pwedeng, hindi siya pwedeng magagamit for the heart. Kasi sa heart channel pa lang, meron tayong wood point. Wood point is actually liver already. Yun.
Oh, nasa heart channel.
Yes, nasa heart channel. And you cannot use liver 8. Kasi if you use liver 8, you're actually tonifying the liver, not the heart. You follow? Kasi tonification point ng liver ang liver 8.
Oh,
And liver 8, how do you classify liver 8?
What's the point?
Kasi points.
So it's a water point.
So hindi mo itatapon
What's the
kasi
point?
kulang lang ito ng heartin. No?
Yeah.
Itatapon mo lang siya sa hose, sa C, kung grabe na yung fire.
I wasn't thinking ng liver 8. Mas liver 1 ang iniisip ko kanina. The wood point ng liver din.
No. Kasi every point has its own tonification and like this one, heart 9 is a tonification, heart 7 is a sedation.
Okay.
Kidney 1 is the
Kaya naka-fix lang
kidney
siya dun sa
7 is
mga
kidney 7 and kidney 1. Diba? Yun. So you need
doon lang siya. Okay.
Okay, so wag
Yeah.
masyadong mag-isip, ganun talaga. So sometimes if we think too much, ang importante kasi dito is you apply it in practice in marami pa ring yeah, I had to admit I had the same problem before, but especially when it's your first time. But when I try to read deeper on kaya makikita mo, doon sa 5 shoe points, meron tayong tatawag na wood point, merong fire point, meron tayong within the channel. Okay?
Okay.
So I hope that's clear, everybody. Hindi pa kayo napagod? Like we're more than 2 hours. And I doubt if everybody, all the others could catch up. We need to do this because we have to level up, diba, Dr. San?
Yes, Doc. Actually, on my part, ilang weeks din ako hindi nakasali. And then we have the
Mabilis lang naman.
construction.
Yeah.
Pero I need to review more.
Yes.
Kakalimutan ko na.
So see you again next week.
Yes.
Sir Michael, did you enjoy tonight's
Opo, Doc. More. Need more deeper and deeper.
So this is like 10 weeks. Meron tayong extraordinary channels. We also have the shoot measurements. So these are like expect more questions.
Very tricky question pero useful naman po, Doc, in my observation. Kasi nagiging deeper kami kasi talaga po kailangan po talaga maging deeper sa sa mga points.
Oo naman, hindi puro lang points na
common.
You have to be different. Alam mo, the patients will have a way of knowing if you really know what you're doing or not. And they would know if you're less. Okay, thank you very much, Ma'am Joy. I think we've reached the time limit na more than 2 hours na po tayo, and I know you look so antok already. And thank you very much for your questions. We hope to see you again next week. No?
Opo.
Can we meet on Thursday? Friday pala next week. Thank you very much. So ang haba ng natin.
Doc, by the way, okay lang, Doc, halimbawa kung Thursday yung availability mo, mag-a-adjust ako, Doc.
kasi meron din kaming meeting na iba, like, no, let's make it, na lang, let's make it really Friday, no? Or if we
Okay,
can make
sige.
it on a Friday, kasi meron ding research si na yan. So, I know
So, November 4,
everyone is available, but I really appreciate your time. Kahit pinuyat na kayo, pero sana, like katulad nito, expect more questions like this. So, I hope everybody had a great time. So maraming salamat po, especially when we go to cases already. So I think we need to do this, no? Ang akin lang kasi, before we go to cases, we need to be familiar with the points that are not usually used, which kasi alam nyo ba, you need to memorize 44 extra points according to PITAC. And you have to memorize 175 points. That's why
175.
yes.
But 175 plus 44 points, Doc?
Plus 44 extra points. So, hindi pa din niya, yeah.
200. Okay.
Oh.
So, we're following. We're the only one doing that.
Ay.
Yung iba nagsi-alisa na, oh. Okay. So, maraming salamat po, and good evening, everyone. Enjoy the long weekend. I'm so excited.
Thank you,
I
Doc.
hope hindi kayo magsasawa. Thank you, Ma'am Ami, Sir Michael,
Thank you po.
Rosanna,
Salamat po, Doc.
Miss Angel, Ma'am
Good
Liv,
luck.
and thank you so much. Have a great weekend, and see you soon. Bye-bye. Thank you.
Okay, bye-bye po.
Good night po.
Thank you po.